Okay, please welcome our next presenter, Ms. CLacy.
Hello, good morning. My name is CLacy. My project is titled Making the Choice Decisions of the Pregnant Teen. So when I was first picking a topic, I didn't really know what I wanted to do. I knew I wanted to pick some type of teenage social issue, but I didn't really know what, or which one. So then, unfortunately, someone I know and very close to actually became pregnant as a teenager. So that kind of became my big deciding factor to need to pick teenage pregnancy as my topic. After I picked my topic, I had to pick a question. And that was actually harder for me than picking a topic, was trying to narrow my question down, because I had like hundreds of questions I wanted to ask, but I managed to narrow it down to 3 that really interlock and go with each other. So my question is, what are the different choices a pregnant teen can make that influences her decision, and how can each affect the mother? And when I started to do my research, I found out that there's really only 3 things that they could pick. They can become a parent by keeping their child, they can put their child up for adoption, or they can abort their child. And with these 3 options, there's many different facets that could influence their opinion. Family is one of them. There's something like that. Money is also a big thing because it's very expensive to have an abortion, and usually insurance does not cover it. So that led me to my internship. I couldn't decide if I wanted to do a medical internship with a hospital, if I wanted to do more of a counseling type thing. So I started looking online, and I found the pregnancy centers of Central Virginia, and I contacted their Orange location, and they told me that I could come in and I could work with them. So my mentor was Margaret Shaw. She's the director of the Orange County location. She's been that for about a year. Previously, she worked for 9 years at the downtown Charlottesville location of the pregnancy centers, because there's about 4. There's one in Culpeper, Albemarle, downtown Charlottesville, and Orange. For my internship, it was mainly a lot of interviewing. I would come up with questions in the classroom or at my house, and I would come in and I would ask Mrs. Shaw, and she would give me her best, all of her information that she had. And if she had a pamphlet on what I asked her, she would go out to what I call the wall of information, and she would give me a pamphlet about the subject. I had a lot of questions about abortion, because it's the biggest choice, kind of the most controversial choice that a pregnant teen can make. So most of my questions were actually abortion based, but I did ask about adoption and raising the child. Another big part of my internship was actually helping at the fundraiser that the pregnancy center hosts in Orange every year. I went on a Friday to the Orange cafeteria at their high school, and I helped set up. We had around 50 tables and about 7 people per table, so we had a big turnout. And the speaker's name was Dan Culp. He was raised, his family adopted special needs children when he was younger, and he had to live his entire childhood watching his family get bullied for being special needs. So when he grew up, and he and his wife decided that they were going to adopt special needs children. They adopted 2 from China and 1 from the Ukraine. And one of his big things was about adoption, not letting anything stand in your way of adoption, including if it's a special needs child. Which leads me to my community service. Ian and I actually combined our topics to make the health fair. He is kind of the one that led it and found people, and I helped him with that. But my main thing is I'm going to be helping my mentor, who's coming to the health fair. I'm going to be at her table helping her, and I'm also organizing a diaper drive for the pregnancy center, because they run a lot on donations there. So everything that they give to the mothers, because they give the moms clothes and diapers and anything that they could possibly need. So anything that I collect at the health fair will be donated to them. And it's on April 25th. We had to move it due to scheduling conflicts. So my kind of mentor for our community service is Miss Wilson, actually, because in order to use a school venue, we had to have a school employee. So we used our senior sponsor, and she's been helping us get our location. So she's the one that helped us get the gym, and she's the one that's been helping us if we need help contacting anybody or anything like that. So my big significance of both my internship and my community service was really community and how it affected the community. With Dan Culp's speech, we had 100 to 200 people at his speech, and just raising community awareness, not only for adoption, but just for pregnancy in general. And with the health fair, we hope to do that too. In Madison, we hope some other communities might join us at the health fair. just raising community awareness with being healthy, and among other things. And something I learned about myself is actually, it's not really about going into this field, because it's kind of a harder field to go into unless you want to be work in an abortion clinic or be a therapist. But it was really more about judgment, because I remember one time I was walking out of the pregnancy center, and this old woman was looking at me like I was garbage, basically. And I was like, why is she looking at me like that? I was so confused, and I realized she thought I was pregnant. She was just like, I cannot believe that this girl would make that decision that young. And it just really stuck with me as how judgmental we can be of other people before we really learn like what their story was. Like she could have not that I would ever hopefully have this problem, but I mean, she could have been raped, she could have been sexually abused at home. You just really don't know why a woman would be in this predicament until you talk to her. If I had to start over completely, I probably would have tried to find like a primary source and try to talk to a pregnant teenager themselves, but I couldn't at the pregnancy center because they have confidentiality problems. So I had to get all the information came from Ms. Shaw or one of the other volunteers that worked at the pregnancy center. But if I had to start over, I would definitely try to seek out a specific person that was pregnant as a teenager, and just allow them, hopefully let me talk about their story. Advice for future government school students, definitely do not procrastinate. I had planned to start in the summer, but I had unforeseen complications that kept me from doing much this summer. So I ended up starting in the fall, and I didn't have a problem with it. It's just definitely easier to at least be thinking about it in the summertime. Even if you don't know specifically, just a general broad topic like a teenage social issue or something like that. So, are there any questions?
You mentioned three possible choices.
Mm-hmm.
Did you go into the impact that each choice would possibly have on the mother? Or,
Yes, I did. With abortion, there's a lot of like psychological effects that can happen to the mother, especially if she feels as though she's kind of killed her child. There's depression, suicide attempts, things like that. With keeping the child, it's more about money because it's really expensive, especially if a teenager doesn't have support of the family. It can be really, really hard to raise a child. With adoption, it was more of the choice whether the mom wanted to be emotionally connected with her child with an open adoption or whether she didn't want to be known with a closed adoption. So adoption is it's harder to have an impact on the mother unless she feels like abandonment, which is one of the biggest things I talked about in my paper, was if a mom feels like she's abandoned her child, then she can have some of the same symptoms that somebody who might have an abortion might have, like depression or something like that.
and does the father play into any of this?
Yes. In Virginia, we actually have what's known as a putative list. It's actually relatively new. If a father thinks he might have fathered a child, he can put his name on this list. And it's so new, it's not really well known, and there's no incentive to put your name on the list. But it's something that a mother could use if she doesn't know who fathered her child. But if the father is not known, it's just the mother's discretion, at the mother's discretion, what she wants to do. Or if the father just leaves the mother, then it's up to her alone. Paternal rights are kind of waived, and it's up to the mom.
Did the pregnancy center have any statistics on teen pregnancy? How many choose abortion, adoption?
I read a
Keeping a
statistic.
child.
Yeah, I read a statistic somewhere that said in America there are about 245,000 abortions to people under the age of 20. It's actually gone down since the 80s with a lot of prevention methods. We have birth control now and things like that. But I think it said about 29 out of every 100 girls who are under the age of 19 will have an abortion at some point in their life when they're teenagers. Anything else?